Welcome to the Key Health. We unlock and enlighten you daily. Today, we are going to talk about diabetes. This video presents the pathophysiology of diabetes for anybody at any level to understand. Subscribe to our channel if you have not already done so, and we can learn together. Let us dive into it. Disclaimer: our videos are for educational purposes only. Please seek medical assistance if you experience any symptoms that might be discussed here. Self-treatment could be dangerous and may lead to self-harm or death. Diabetes is a chronic health condition that alters the manner in which a person's body converts food into energy. Most of the food that one eats is converted into glucose, a form of simple sugar that is assimilated within the body to sustain metabolic processes. Depending on a person's energy demand, the body uses its neurosensory pathways to adjust the glucose levels in the blood as needed. The actions take place by alternating levels of insulin and glucagon, both of which act interchangeably to release or trap the glucose molecules respectively. The most notable anomaly arises when lower insulin levels are evident in the body or when the body becomes unresponsive to the release of insulin. When this happens, blood glucose levels remain elevated, thereby exposing the victim to the development of other complications such as heart attack, hypertension, and kidney failure, among others. There are three types of diabetes, namely type 1, type 2, and gestational diabetes. Let's look at the risk factors. Type 1 diabetes. There is no clear cause for diabetes, but most cases are attributed to family history, whereby, if one's close relative has the disease, there is high probability to develop the same disease. Age plays a major role in that children and young adults are at a greater risk of developing type 1 diabetes. Researchers are yet to develop an approach to prevent the development of the disease. Type 2 diabetes risk factors include: age. Mostly affects people over 45 years of age. Family history of the disease. Being overweight. Pre-exposure to gestation diabetes. Being Afro-American and Hispanic. Other preconditions such as the liver disease have been known to trigger the development of the disease. Clinical manifestations. Since diabetes symptoms appear similar to many other ailments, specific diagnostic patterns are required for effective treatment. The general clinical manifestations include, but not limited to, persistent pee, especially during the night, requiring one to pee more often, being very thirsty most of the time, having blurry vision, lethargy, tingling in the extremities such as the hands and feet, having wounds that heal slowly, and being frequently attacked by other opportunistic diseases, thereby implying lowered immunity. Diagnosis and treatment. Tests are carried out to determine the type of diabetes a patient is suffering from. Moreover, type 1 diabetes has more severe symptoms that develop rapidly as compared to the hideous type 2, where the signs do not show until late in life. Recent cases, however, have shown that the disease affects children and young adults, thereby calling for better understanding of the risk factors for early diagnosis and better treatment. Tests to diagnose diabetes include: A1C test. The test entails recording the patient's blood sugar level for the past 2 to 3 months and then determining the average. The average readings are translated as follows: below 5.7% is normal, 5.7%, 6.4% is prediabetes, 6.5% and above is diabetic. Fasting blood sugar test. The test is done in the morning after fasting overnight. Readings above 126 mg DL indicate that one has diabetes. Glucose tolerance test. The test involves the patient fasting overnight, then they are given a drink rich in glucose. Then the glucose levels are monitored at intervals of 1 hour after consuming the drink. The test taken on the second hour is used to determine glucose tolerance. Blood sugar levels above 200 mg DL indicate that the patient has diabetes. Treatment plan. The treatment plan involves embarking on healthy lifestyle changes, including engaging in physical exercises, reducing weight and becoming diet conscious by eating healthy, balanced diet. Moreover, maintaining a healthy psychological approach to life by eliminating life stressors is vital in managing diabetes. Medication is prescribed to patients depending on the diagnostic outcomes. However, lifestyle change, proper dieting and mental awareness present a vital component of the treatment plan. Like and share our video so that we can reach more people who need this information. Thank you for watching. See you in the next one.